But then at what stage should we go for a hair transplant when there's a lot of hair loss?
Hair transplant is one thing when it is very severe or your hairline has receded a lot. Because usually when the hair is gone in the center, you may not look older. But if the hairline has gone back, so people who look at you from the front or a side profile, they feel that you're 10 years older than your actual age. So a 20-year-old, if he has baldness, but the two sides have gone a lot, so he will look like a 30-year-old. So for such people, it's very important, irrespective of the age, to get a proper hairline done. Irrespective of transplantation, where the hair has thinned out. For women, it's usually the partition widening. That's called female pattern hair loss. And then slowly in between the hair, you can see the scalp visible. So for those things, we do something called as PRP, platelet-rich plasma treatment, wherein we draw the patient's blood, separate the growth factors, and we inject them into the scalp. So this works very well. Usually we do like monthly once for a couple of sessions, and once the hair growth is good, they can come for maintenance once in 3 months or 6 months. PRP works very well for men also for initial stage of baldness in grade 2, grade 3 initially. But once they enter grade 5 and grade 6, where the center is completely bald and they have a lot of hair behind, a lot of body hair, then that's when they go for hair transplantation. But irrespective whether you go for PRP or hair transplantation, medical management is very important. So there are some solutions which we tell them to apply at night. The good shampoos we suggest depending on whether they have dandruff or not. So, we do all the vitamin tests and the hormonal tests, because sometimes it's the thyroid which is causing the problem. Sometimes in women it's polycystic ovarian syndrome. So which causes severe thinning of hair, then facial hair, a lot of acne, lower face acne, obesity, and blackness and thickness of neck, underarms, inner thighs. These are the things women nowadays experience because of hormonal imbalance. So in such conditions also, apart from doing this PRP, which gives wonderful results and no side effects because it's from your own blood. So we are not taking out the growth factors somewhere external. So what is more pure and safe than your own blood? So doing this and properly analyzing the cause, doing your hormonal assays and vitamin assays, we will do the treatment.
Thank you so much, Dr. Vimala, for coming to SCube TV and speaking with us. It was so lovely chatting with you. It was such an informative session, and you actually educated us a lot about different topics. So thank you again for taking out time and doing the show.
Thank you so much, and wonderful anchoring. I really enjoyed it. And thank you, SCube TV viewers. I hope I was really of some help and advice. If you have any issues regarding skin and hair, you're more than welcome to visit our Dr. Vimala Skin Hair Laser Centers at Medipatnam, Shakepet, Gachibowli branches. Thank you.